Let's discuss the treatment. The first stage is conservative therapy. And when carrying out this this treatment, it is necessary to follow a certain sequence. Why? Because the elements are at different stages of development. So in cases of acute weeping inflammatory processes, lotions and aerosols are used. In cases of acute inflammation without weeping lotions, aqueous suspensions, powders, pastes or creams are used. For subacute inflammation, creams and pastes can be used. And for chronic non-specific inflammation, ointments and warming compresses are recommended. With pronounced infiltration in the lesions, ointments and creams with keratolytic properties are used. And at the stage when the skin process is already regressing, ointments, balms or creams with biological additives and vitamins are used. It is advisable to use mattress covers and textiles coated with silver for children's clothing and for a newborn baby. There are several types of medications. The first of these are emollients, ointments, soaps, and hydrolotions. These include products like Topicrem, Avena, Alpica, and Weleda. Emollients can contain heptins, and therefore, with prolonged contact, they themselves can cause dermatitis. What is not recommended? In children under 2 years old, medications, ointments, and creams containing urea, lanolin, and propylene glycol are not used. Wax is also not used. There are also products with sodium hypochlorite, bacterial lysates, and prebiotics. We very often use topical glucocorticoid medications. How are they applied? They are applied according to the fingertip unit rule. Duration the fingertip unit rule means that you should apply the cream in a thin layer along the length of the child's fingertip. The duration is up to 2 weeks, and sometimes we can even extend it to 20 weeks. Calcineurin inhibitors are also used, medications such as pimecrolimus. However, when using this medication, you should avoid direct sunlight. There are also restrictions regarding medications, drugs based on Declin, Naftalan, and Ictiol can be used, but currently are not. They are prohibited for use in children. For anti-itch therapy, we use medications containing polidocanol. It is included in a medication called neotannin. This is a combination of synthetic tannin and polidocanol. This medication is very often used during flare-ups of atopic allergic, contact dermatitis, eczema, psoriasis, and diaper dermatitis. It can also be frequently used for chickenpox, herpes, fungal skin infections, and superficial pyodermas. Polidocanol is also an ingredient in the well-known creams and gels Camestat and Dentinox. These are lidocaine combined with polidocanol. What I want to emphasize is that at present we do not use antihistamines to control itching. In very severe cases of the disease with quite pronounced lesions, biological therapy is sometimes used. This includes dupilumab, which is an inhibitor of interleukin-4 or interleukin-3. They play a key role in the development of inflammation. This is especially true for type 2 inflammation in atopic dermatitis and other allergic diseases. Phosphodiesterase inhibitors such as crisaborole are also used, as well as the already familiar to us acid therapy. It is absolutely necessary to vaccinate these children against the varicella virus because the disease can be very severe in children with atopic dermatitis. It is very important to remember that the previous belief that bathing children is prohibited in cases of atopic dermatitis is now outdated and incorrect. Ideally, of course, children should be bathed daily and baths should be used. Again, this is better than a shower. A bath hydrates better, cleanses better, and provides better access for medications to the epidermis, improving the function of the epidermis itself. For cleansing, you can use short, cool baths lasting about 10 minutes with a gentle cleansing base, where the pH of these products is around 5.5, and they do not contain alkalis. And when cleansing the skin, It is preferable not to rub the child, but only to gently pat dry and not to wipe completely dry.